So as someone who's really been on the front lines and had to build those relationships and kind of you've kind of described your process in helping to educate and be a team member with your client. What are the biggest mistakes that you typically see dentists making?
That's an excellent question. I think far and above from any of the practice analysis that we have done with customers, which is our kind of, consulting tool that sets benchmarks and looks at their actuals to try to find areas of opportunity. The thing that I've seen in every single practice, every single time, is their hygiene recare. And there's a couple key statistics that every dentist should know around that. One, your active patient count is different from patient of record. So patient of record being every patient that's ever come through the practice that's in the practice management system. Whereas active patients, it ranges based on the consulting company you use, but it's usually patients who've had a procedure done in the last 18 to 24 months. And that's really your book of clients, is those live bodies. What we know through all of the work that we've done and all the companies that we've acquired is that when you have a strategic focus on making sure that your hygiene patients have their butt in a chair 2 times a year, that does wonders not only for production growth, but most importantly, patient retention. You would expect to see 10% attrition in active patients every year because patients move, patients pass away, patients change insurance, they get mad at you for whatever reason. That's just we all have churn, right? So the best way to combat that is to have a strategic, aligned focus with your entire staff around making sure that your recare list is full. And the most important reason it's that and not necessarily delivering implants or crowns is that there's a really important relationship between preventative production and restorative production. For every $1 you produce in hygiene, you typically will produce $3 in restorative. And that's because you're discovering treatment in preventative in the hygiene chair. So if you were to say increase patients by 15 in a month in your recare list, estimate that that's $100 in production. So there's $1,500 right there. But the most important number is all the treatment that you discover in hygiene, which is 3x of 1,500. And if you do that at scale consistently with your entire staff all the time, you can add 10, 15% to your production in a pretty easy way. It's a low energy lift. And unfortunately, most dentists aren't educated around that or given the tools to identify it, track it, and implement it. So that's really where we come in, is to show them